your job as a patient is not to be more aware of these things, right? Like you are not supposed to know what's wrong with you. That's what we're here for, right? So you can't say that, you should do more or better. That's my job. My job is to educate you in a way that you relate. Because if I just talk at you about numbers or I talk to you about stats and you're not an engineer, you're very visual, you're just going to ignore it, right? So the reality is it's my job to learn how to talk to you, right? That's where we come across as professionals. So being able to say to you, well, look, Tyler, I know you don't have any issues. I know you don't have any headaches or pain or whatever, but here's what I see. Here's, what we find or I found on the exam, your jaw joint, this and that. Maybe we did a scan, a CBCT scan, combine it with T-scan, everything else. It's telling me that, you're really high risk for X, right? Let's say TMJ, like TMJ issues, right? And so I know you don't have any problems right now, and I do this all the time, by the way, because patients don't always tell you the full story, right? People will come in, I had this all the time. Oh, I don't have any headaches. Yeah, you do. No, you don't. No, I don't, right? So it's like, I'm not gonna argue with them. So I'll just say, I appreciate that you don't have any pain right now. You mentioned that you don't get headaches or anything like that. We talked about it, but you're at really high risk for flipping over, right? So jaw joint patients are like this. You could be on the fence for a long time and then have no issues, and then one day something tips you over, and once you jump over to this side, there is no coming back, right? You're gonna need treatment. So when you start to feel these types of symptoms, and I'll list them, whatever, maybe it's ringing in the fingers, maybe it's, tingling in the fingers, ringing in the ear, I'll list all the TMJ related stuff. When you start to feel those, that's when it's time to have a conversation about this. Now think about what happens to that patient, right? If you hear that and now you leave, it's like if you buy a new car, you're gonna start to notice that car everywhere you go, right?
Sure.
Which you didn't notice it before. You're like, oh my God, everybody has this car, right? Same thing with this. If I say to you, okay, well, anytime if you start to have these symptoms, let me know, because we need to start having that conversation. Now you go, and every headache, every sound, your hand went numb, whatever, you slept funny, all of a sudden you start thinking TMJ, right? So now you're like, holy crap, maybe I am, you know what I mean? And not to say you're gonna lead the patient the wrong way. I'm talking about integrity here, I'm not talking about manipulation, but the reality is how we communicate to our patients is key in getting them to see that it's a bigger picture than just a cleaning and a checkup, right? So now, if I have supporting evidence of your condition, I'm not making shit up, it's right there, right? And the exam. Then when you are ready, when you come back to me, I don't have to do anything except to say, okay, let's talk, right? Because you're already sold on the treatment. You already know that you need the treatment. How you pay for it, you'll figure out. I don't have to persuade you to do anything, right? So when you come back, you're already educated in the sense that you're motivated by what you saw and by the symptoms, and now the case presentation is a planning session, not a manipulating session. So that's what it allows me to do.